Student 15. नहीं तो उसकी नहीं आ रही थी बर्ड की. So Bismillahirrahmanirrahim. Assalamu alaikum everyone. Dr. Kanwal from Pathology and Dr. Kanwal from Pathology Department. So later we will continue the talk of breast, and today we will discuss about the breast carcinoma. So first of all, we will discuss about the risk factor for invasive breast cancer. So there are certain conditions which causes no increased risk, like mastitis, fat necrosis, mammary duct ectasia, non-proliferative diseases, fibroadenoma. These all conditions not increase the risk for invasive breast carcinoma. And they are slightly increased risk, like increased risk of about 1.5 to 2 times for the development of invasive carcinoma occurs by conditions like moderate to florid hyperplasia, sclerosing adenosis, fibroadenoma, and duct papilloma. And there is moderate increased risk or increased chances of development of increased carcinoma of about 4 to 5 times by atypical ductal hyperplasia and atypical lobular hyperplasia. Peter, yesterday we discussed all these conditions, and today we are starting our topic of breast carcinoma. And in breast carcinoma, anyone can ask about the risk factors or risk factors of a lesion of a breast for the development of invasive carcinoma. Because this is also written in your book, Robin, in a tabular form. There is no increased risk, there is slightly increased risk, and there is a moderate increased risk for the development of a breast carcinoma. Okay, no increased risk, slightly increased risk, and then there is a moderate increased risk. So now the carcinoma of the breast. So epidemiologically, it is the commonest malignancy in women worldwide. And the next is the cervical cancers, then the colonic cancers, and then the stomach cancers. As the risk factors are concerned, as far as the age is concerned, the incidence of breast cancers increases with increases age. It is uncommon before the age 25 years, because before the 30 years of age, the commonest malignancy in a breast is fibroadenoma. And then the increases chances of the carcinoma to the time of menopause and then slows down. So the next risk factor is family history. Approximately 10% of breast cancers is due to inherited genetic predisposition. A woman whose mother or sisters has had a breast cancer is at increased relative risk of 2 to 3 times compared to other women. Okay, we are discussing about the risk factor. In a risk factor, there are certain breast lesions with no increase, with slightly increase, or with a moderate increased risk. Then we are discussing the epidemiologically, in fact, it is very commonest tumor in female. And then there are certain risk factors like age, like family history. Okay, a woman whose mother or sister has had a breast cancer is at increased relative risk 2 to 3 times compared to other women. So now, at least 2 genes that predispose to breast cancers have been identified. These genes are BRCA1 and BRCA2, or we call it BRCA1 and BRCA2. Whether anyone can ask about the genes. So there are 2 types of genes, mainly the BRCA1 and the BRCA2. And a mutation in these tumor suppressor genes also predispose affected women to ovarian cancers. So beta, you must know about the genes. These are the BRCA1, BRCA2, and these are the tumor suppressor genes. Okay, along with the breast carcinoma, they can also predispose the woman towards the ovarian cancers. Okay. So now the benign breast disease, certain type of benign breast diseases as we already discussed, and then there is a history of other cancers. A history of a cancers in other breast or a history of ovarian or endometrial cancers can increase the risk of a breast carcinoma. So now the hormonal factors. With the increased level of estrogen, increase the risk for the development of a CA breast. Like the conditions includes early age at menarche, late age at menopause, nulliparity, late age at first childbirth, obesity. Okay, these all condition causes the increased level of estrogen, and these estrogen is responsible for the increased risk of a invasive carcinoma. So the other environmental factors includes high fat intake, excess alcohol consumption, ionizing radiation. So, what is the meaning of BRCA1 or BRCA1 or BRCA gene? It is a gene that normally acts to restrain the growth of a cell in the breast. That's why we call it, it is a tumor suppressor gene, but which when mutated, it predisposed to the breast cancers. The gene's full name is breast cancer gene. Okay, it stands for breast cancer gene. Okay, anyone can ask what is BRCA gene? It is stand for breast cancer. The BRCA gene or BRCA gene belongs to a class of a gene known as a tumor suppressor gene. So, beta, the genetic factors contribute to only 5% of all cases, but may account for 25% of cases who present before 30 years of age. The responsible genes are BRCA1 and BRCA2. The BRCA1 is present on chromosome 17q, which predisposed to both breast and ovarian cancer, while the BRCA2 are present on a chromosome 13q, restricted to the breast cancers and associated with the male breast cancer. Because this may ask in your MCQ. ये देखिएगा जरा, ये यहाँ से close है. So beta, this may ask in your ECQ about the following or the genes can cause the development of male cancers, BRCA1, BRCA2, etc. So you must know that BRCA2, okay? BRCA2 is associated with the development of male breast cancers. Okay. So now till now, okay. So till now, we covered our topic of risk factors of development of a invasive breast carcinoma. So these risk factors including certain breast lesions with slight increased risk, with moderate increased risk. Then we discuss the other risk factors like age, increase the risk of malignancy, family history, a woman with sisters and mothers increase 2 to 3-fold chances of development of malignancy. Then there is a hormonal status, increased estrogen level causes the increased risk of malignancy, and the conditions include early menarche, okay, and the nulliparity, and then there is a genes, especially the BRCA1 and the BRCA2. So the etiology of breast cancers in most women is still unknown, most likely due to a combination of the risk factors like genetic, hormonal, and environmental factors. So now beta, we are discussing about the classification. Later anyone can ask about the classification of breast cancers. So breast cancers can be divided into two classes, the ductal carcinomas and the lobular cancers. The ductal carcinomas can be divided into two types, the ductal carcinoma in situ and the intraductal carcinoma, while the lobular carcinoma can be divided into LCIS, lobular carcinoma in situ, and the ILC, invasive lobular carcinoma. Okay. We can divide the breast carcinoma into two groups. The one is the ductal and the other is the lobular. Okay. In a ductal, we can divide into DCIS, ductal carcinoma in situ, and into an invasive type, invasive ductal carcinoma. Okay, and the lobular carcinoma is also divided into two types: the LCIS, lobular carcinoma in situ, and ILC, invasive lobular carcinoma. And the ductal type is the most commonest type of breast carcinoma. Okay, or we can also divide the ductal carcinoma in two groups. One is in situ and one is invasive. Okay. So, the ductal carcinoma in situ, DCIS, it is characterized by a proliferating malignant cells within the ducts that do not breach the basement membrane. Okay, the atypical cells, the malignant cells, are present with intact basement membrane. There is no breach of the basement membrane. And there are different patterns of DCIS. Later, anyone can ask in your MCQ, in your Viva, what are the different types of DCIS. Okay, you have to prepare this topic like this. There are different patterns of DCIS, like comedo type, in which there is a central necrosis, like cribriform type, the cells arranged around with the punch out spaces, cookie cutter appearance, papillary type with papilla formation, and solid type cells with fills the space. Okay. Now anyone can ask about the types of DCIS. You said the DCIS are different types like comedo type with central necrosis, like cribriform type. The cells arranged around a punch out spaces or a cookie cutter appearance. Papillary type with papillae formation and solid type. Okay, beta. I will show you this picture. This is the cribriform type of a DCIS, in which these are the atypical malignant cells, and this one is the central necrosis. Okay, and this one is the cribriform type. Okay, and this one is the papillary type. Their formation of a papillas. Okay, papilla formation. This is the hyperpop image of a cribriform type, a comedo type of a DCIS. Very high grade tumor. So, that there are different grades. The DCIS can be graded into different categories like low grade, intermediate, and high grade. The high grade includes the comedo type DCIS. Classically, it is a high grade type. The DCIS is often multifocal, and malignant population can spread widely through the duct system. Okay, it can expand the mass by widely spread through the duct system with intact basement membrane. Okay, so now the lobular carcinoma in situ. The lobular carcinoma in situ is relatively uncommon lesion. There is, like a DCIS, there is a malignant proliferation of cells but with intact basement membrane. And these malignant proliferation of the cells are of small type, uniform epithelial cells within the lobules. Okay. Also, at marked increased relative risk for invasive cancers, 8 to 10 times in either breast. Okay. The LCIS can increase the risk of malignancy in either breast. Okay, so whether this is the microscopic image of LCIS. As you can appreciate it there, these are the small uniform cells, and these cells are present in the lobules. Okay, now the invasive ductal carcinoma. Beta, I repeat again, till now we are able to know about the risk factor of carcinoma of the breast, and the classification and the types of the DCIS. As far as the risk factors are concerned, there are certain breast lesions with slightly increased risk, with moderate increased risk for the development of CA breast, and you must know the name of these lesions, okay, according to their slightly increased risk and their moderate increased. Then there are certain factors like age, like hormonal status, like family history, like gene. Beta, you must know about the BRCA gene. Anyone can ask about what is BRCA gene and what are the types of BRCA genes and what other cancers can be seen in association with BRCA gene. Okay. Then till now we are able to know about the Types of breast carcinoma. The breast carcinoma is divided into two types, the ductal and the lobular type. The ductal type is further divided into the DCIS and the invasive type. Okay, and the lobular is also divided into two types, the LCIS and the invasive lobular carcinoma. Okay, then we discuss about the DCIS. What is DCIS? Anyone can ask? DCIS is actually a ductal carcinoma in situ. Beta, what are the types of DCIS? Very important. There are different types like comeda type, cribriform type, like solid type, like papillary type. Anyone can ask about the grading, low grade, intermediate, and high grade. Okay. And then we also discuss about the features of DCIS, like comeda type is associated with central necrosis, cribriform is associated with a punch out spaces or a cookie cutter appearance, and the papillary is associated with papilla formation. Then we discuss about the LCIS. LCIS is actually the lobular carcinoma in situ, in which there is a small uniform cells are present in the lobule with intact basement membrane. Okay. Now we start our new topic, that is invasive ductal carcinoma. Whenever there is invasion of a malignant cells through the basement membrane into the stroma. So, but it is the commonest form of breast cancer. Increasing incidence of screen detected cancers in developed countries, usually smaller, having shows a much better prognosis. Mammographically, it can be detected. So, the clinical presentation of invasive ductal carcinoma include hard, irregular, palpable lump. Okay, patient may present with a complaint of a hard mass, hard, irregular mass, or there may be the presence of a fused orange appearance in which there is a lymphatic obstruction by a tumor cells causes increased thickening and dimpling of the skin. Okay, and then there is a Paget's disease of the nipple, in which there is an ulceration and inflammation due to the intraductal spread up to the nipple. Okay, patient may present with a lump, may present with a fused orange appearance, and may present with a Paget disease of the nipple, in which there is ulceration and inflammation of the nipple is seen. And this Paget disease is clinically is very mimic with the eczema. So there may be the tethering of the skin, okay? There may be the retraction of the nipple, there may be the axillary mass spread to the regional lymph node, or there may be the distant. In tethering of the skin, there is a contraction of the skin is occurred due to the by a pulling effect of a tumor. Okay, this tumor causes the pulling effect of the skin. So there is a tethering of the skin, and the retraction of the nipple may be seen axillary mass, because we know that the breast is drained into the axillary lymph node. So axillary mass can be the first symptoms, or the distance metastasis, mainly the lung, the brain, and the throat. Okay. So, beta, this is the gross image of CA breast. Anyone can ask in your Viva or ask your in your as you do that, what is the gross appearance of CA breast? As you can appreciate it, beta, this is yellow is the breast parenchyma. Okay, this is whole is the breast, and this yellowish. There is a yellowish, white, firm, irregular. Okay, as you can appreciate it, that this is the normal breast parenchyma, and this whitish grayish white area is the tumor, and it is infiltrating. It is irregular. Okay, grayish white, firm, irregular mass. Okay, and there are different histological type of exist. The most common is the invasive ductal carcinoma of no spatial type. Okay, this is the commonest type of no spatial type. This type is characterized grossly by an irregular hard mass. Histologically, it shows the infiltrating clusters of malignant cells in a dense fibrous stroma. Okay, means हमारे पास अगर invasive ductal carcinoma of no spatial type है, NOS type है, so we can see that the malignant cells means the atypical cells infiltrating into the surrounding stroma. Because the main features of CA breast include there is a And the glands can be arranged in a glandular configuration with absence of the myoepithelial layer. The tumor cells are lined by a single layer. There is absence of a myoepithelial layer. Okay. I repeat again, if anyone can ask about the gross features, you can say that the grossly, the tumor shows a grayish, white, firm to hard, irregular mass. And microscopically, there are different types. The most common is the annulus type, which we call as the no spatial type. And this type histologically shows the infiltrating clusters of malignant cells which infiltrate into the dense fibrous stroma. As you can appreciate it that better, this is the image of invasive CA breast. The tumor cells are arranged in a glandular, in a tubules formation. Okay, these are the tubules. These are the tubules. Okay, and this one is the solid area. Okay, and these tubules are lined by malignant cells, atypical cells, and these cells are infiltrating into the stroma, and these are lined by a single layer with absence of a myoepithelial layer. And better, you can also appreciate it that these cells are lined by a atypical cells showing a hyperchrom. These cells are having a hyperchromatic nuclei. Okay. So, the other special histological type of invasive ductal carcinoma include medullary carcinoma. Later, anyone can ask, what are the features of medullary carcinoma of the breast? So, features include circumscribed mass. Okay? Medullary carcinoma is basically a circumscribed tumor in which microscopically there is a sheets of malignant cells with dense lymphoid stroma with dense lymphocytic infiltration. Okay, the other types include tubular carcinoma, in which the tumor cells are arranged mostly in a tubular pattern. Okay, tubules formation, and these tubules shows a characteristically a teardrop appearance. Okay, there's I repeat again, there are different types. First, we discuss about the NOS, IDC, invasive ductal carcinoma, NOS, no spatial type. These shows tumor cells infiltrating into the stoma. And there are certain specific type like medullary carcinoma. The features include circumscription, lymphocytic infiltration, okay, lymphoid stroma. Then the third important type is tubular carcinoma, in which the tumors are arranged in a tubules formation. Okay, where the teardrop appearance like tubules, बनेंगे उसमें से उसकी tubule, and then there is a teardrop appearance on histology. Okay, the other types include mucinous type or a colloid carcinoma. As the name indicated, in this type, there is the malignant cells are present in a pool of a mucin. Okay, there is a large mucin in which the malignant cells are present. And then there is a papillary carcinoma in which the papillary formation like papilloma along with invasion. Beta in papillary formation means then there is a finger-like projection of a tumor cell. In the papillary configuration, where there is a fibrovascular core is seen. Okay. So now we are discussing about the second most important type, that is invasive lobular carcinoma. Okay. So I repeat again, Beta. Till now we are able to know, Beta. Today we are discussing about the new topic of breast, that is carcinoma of the breast. Okay. In carcinoma of the breast, we must know about the risk factor. Okay. These risk factors including certain breast regions, age, epidemiology. There are certain family history, other factors. Okay. Then we discuss about the types of breast carcinoma. The most common types are two types: invasive ductal carcinoma and invasive lobular carcinoma. Because the commonest type is invasive ductal carcinoma. Okay. Then we must know about the different types of DCI, different types of ductal carcinoma. One is invasive, another is in situ. Because anyone can ask about DCIS, you must know what is DCIS. DCIS is ductal carcinoma in situ. You must know about the different types of DCIS, like cribriform, like solid, like papillary, okay, like somatotype, okay, and then there is a different grading. And then You must know about the LCIS. LCIS is lobular carcinoma and cycling. Then later we discuss about the different types of invasive ductal carcinoma. Later anyone can ask about the morphology. If anyone can ask about, if anyone asks about the morphology, then you must prepare in such a way that morphology include the gross features as well as the microscopic. Grossly, the carcinoma tumor of the breast shows grayish, white, firm to hard, irregular mass. And microscopically, as we know that there are different type of breast carcinomas. In respective carcinoma, these include NOS. In NOS, the tumors are arranged in a planar configuration, and there is an absent. Better must keep it in your mind that there is an absence of a myoepithelial layer. Okay, the tumor cells are lined by a single layer. Okay, then there are a different histological type of CA breast with specific features like medullary carcinoma. Medullary carcinoma shows a circumscribed mass with lymphocytic infiltration. Okay, then there is a tubular carcinoma. In tubular carcinoma, there is a tubules formation. The tumors is mostly arranged in a tubular configuration. Then there is a mucinous carcinoma. In mucinous carcinoma, the tumor cells are present in a pool of a mucin. Okay, and then there is a papillary carcinoma, in which there is a papillary formation. So the next type is invasive lobular carcinoma. It is much less common than the invasive ductal carcinoma, and it can present with the similar features. Patient may present with the similar clinical features like palpable mass, like huge orange appearance. More likely it's to be bilateral or multicentric. बेटा अगर आपके MCQ में clue दिया जाए about the bilateral and multicentric, then you must think about the invasive lobular carcinoma, because the multicentric and the bilateral is associated with the invasive lobular carcinoma. Okay, and the multicentric tumor means there is a multiple lesion within the same breast. Means within the breast, one tumor is lies here in this quadrant, another tumor is lies in the central portion. Okay, so there may be the invasive lobular carcinoma may present with the appearance of multicentric and the bilateral. It may involve the both breasts. So the classical histology, beta histology of invasive lobular carcinoma is very, very, very important. It includes small uniform cells, and these cells are arranged in a strands or column within the fibrous stroma. Indian filing pattern. Better please keep it in your mind this word, Indian file pattern. Invasive lobular carcinoma. In invasive lobular carcinoma, the tumor cells are arranged in an Indian filing pattern. This means that the strands or column within a fibrous stroma cells are present individually. Single cells are present in a line, in a column, in a strand, in a fibrous stroma. Okay, and there is around uninvolved drug with a bullseye appearance. Metastasize more frequently to CSF, to the surface and pelvic organ. Later, I will show the image of invasive lobular carcinoma. As you can appreciate it that these tumor cells are present in us. These tumor cells are singly present, and these are present in a column or a strand, and they look like and this pattern we called it Indian file pattern. The tumor cells are present in Indian file pattern. Beta, anyone can ask why the tumor cells are present individually or scattered or टूटे से एक दूसरे से, why they are present in invasive lobular carcinoma? So you must know that there is an ecadherin. Ecadherin is present. There is an absence of ecadherin in invasive lobular carcinoma. Okay, normally ecadherin causes the cells to adhere to each other. Okay, there is absence of ecadherin in invasive lobular carcinoma, so the tumor cells are separated, and they are individually and separated. These cells are present, and these are arranged in a Indian file pattern in which the tumor cells are present, are arranged in strands. Okay, so because this is all about the CA breast. Okay, if you have any query, you can ask here. or you can ask in your WhatsApp group. If you have any query, you can ask Beta. And hand raise here. तो अनम्यूट कर जो इनमें से हाथ किसने दिखा है हैंड रेज में सबको बस वो सब ठीक है चले थैंक यू सो मच थैंक यू बेटा थैंक यू